You're listening to Plug Into Health with Prevea Health, exploring healthcare topics that matter to you, the latest developments in health and medicine, and the inspiring stories that emerge from Prevea Health, our partners, and the communities we serve. Welcome to Plug Into Health. Companies that set the bar for success and excellence have a clearly defined set of values. They are the beliefs, philosophies, and principles that help to guide and drive those businesses and organizations. On this episode, we're taking a deeper dive into the values that Prevea Health is guided by. And for this, we bring in Dr. Ashok Rai, the President and CEO of Prevea Health. Thank you for joining us for this episode.
Thanks for having me, Angela.
For those who are new to Prevea Health, who are we and what do we do?
You know, we're a pretty unique healthcare organization. We're a group of physicians. Actually, Prevea is owned 50% by its doctors, and the other 50% are hospital partners, HSHS. So it's a unique 50-50 partnership, really committed to the health and well-being of our community. So we are clinics spread throughout the state of Wisconsin, located in the same regions our hospital partners are, but providing that care both within our hospital walls, within our clinic walls, and a lot of times outside of all of those walls.
Yeah, and really, we can provide health care for so many people, no matter what stage of life you're in, from primary care to those regular checkups to highly specialized care too.
Yes, you know, we really are the full spectrum of healthcare from the day you're born or even before that with our OBGYNs and the great specialties they offer to our pediatricians and family practitioners taking care of children to sometimes when our children need us the most, such as pediatric cancer care or pediatric orthopedics, spreading all the way into adulthood with primary care doctors to keep us healthy, cardiologists there to take care of our heart, surgeons there to take care of us when we need that, orthopedic surgeons to keep us moving, really the whole spectrum of healthcare.
We've set the stage for who we are, what we do. Why is it so important that we have a clearly defined set of values?
You know, so often publicly a company like us will talk about their mission and vision, which is really important. So our mission to take care of people with passion, pride, and respect, that means a lot to us. Our vision, the best place to get care, which means quality and services, number one. We want to be the best place in healthcare to receive care. And the best place to give care, we want to be the best place, you know, to work in healthcare. And we really do strive for that. Are we perfect? I don't think any organization is, but it's what we strive for. But what makes all of that happen, what drives that mission and vision is what we do every day. And really, to me, what we do every day is living our values. So when we define our values as an organization, it's how we talk internally to make that mission and vision come true.
And I think it's important that we actually take extra time to talk about this. Maybe in many cases, people might go through a new employee orientation at any business or organization, and you hear those key phrases like vision and mission and values. It's one thing to talk about them. It's another thing to really understand them and live by them.
Most definitely, you know, and living by your values is what makes that mission and vision possible. But you need to educate, and you need people to understand as they come into the organization. And I think all of us need reminders. I mean, I've been at Prevea now 21 and a half years, and it's nice to hear our values being articulated, what we do every day, but really articulating that in words that we all understand, that we all share together, words that came from us. And I think that's really important, that our values really are what we do every day, and they're defined by our own people.
Yeah. That's kind of the next idea I wanted to bring forth is how do we come up with these values? These weren't values that were just decided in a boardroom one day.
No, this isn't like a board of directors saying, hey, this company needs values, or a leadership team saying, hey, this is how we want to judge our people. And I think in a lot of cases people do that in companies, but that's not the approach Prevea wanted to take. We knew that our mission and vision is important to everybody here. And instead of trying to figure out what was making that happen, it was better to ask our own people, how does it happen? What are the things that matter most to us every day that you think drives that mission and vision? And really groups of employees coming together in rooms, brainstorming around this, wordsmithing it. That's always fun when you have 50 people all having a suggestion on it, but really narrowing it down and really created from our people to say, this is what we think we are. This is what we think who we are in our values. And as we train new people coming into our organization, or as maybe you want to evaluate us, this is what we'd rather be evaluated on. These are our values. And that's really the genesis of all of this.
Let's get into our 5 core values. The first one being be kind. What does it look like to be kind, Dr. Rai?
We're in healthcare. So kindness has a lot of different ways of looking at it, a lot of different definitions. A long time ago when we were going through our customer service training, I reminded employees on a daily basis that I'd say 99% of the time the person that's sitting across from us is probably having a worse day than us. They may be there for a mammogram, a normal screening mammogram, but in the back of their head they're thinking about their grandmother who had breast cancer. It's our kindness from checking that patient in to what happens in that mammogram booth or in that exam room or in that operating room or even when we answer the phone. It's that kindness that reminds them that we're there for them. So be kind to me has so many different ways of interpreting that within our organization. But in the end, it's about making somebody else's day better. And kindness is a great way to do that. And in healthcare, it means a lot.
And I feel like maybe empathy goes in there a little bit too.
Yeah, empathy and sympathy. A lot of us in healthcare, we're patients too. We remember what it's like. I know in the last year, I definitely have changed my perspective on a lot of things being a patient. But the empathy that we show, the understanding when you're checking in, and we can see that anxiety in your face sometimes. And it's that extra special word, the extra special attention to detail and kindness that I hope goes a long way to demonstrating this is a core value of who we are, to be the best place to get care, to live that vision.
Yeah, and going on to expand on that, the best place to give care, knowing that we should also be showing kindness to each other as within, the Prevea family.
Most definitely. If we're not good to each other, how can we be good to everybody else? So we have really focused on that as a family, is really being kind to each other as a demonstration of our team, our family, outwardly caring for people we need to inwardly care to.
Let's talk about our next value, which is be responsible. What does that look like?
I think responsibility really comes down to the integrity of what we do every day and the pride in what we do every day. We're in a very difficult industry, and responsibility means a lot. To be committed to the health and wellness of communities takes a lot of work, takes a lot of truth of living what we do, and that responsibility aspect. So internally, it's that integrity that we have, that are we all rowing in the same direction in the best interest of our patients, and the pride we take in that. And that's really what responsibility is to us, is, are we focused on that patient? Are we focused on the health of our community? And how do we live that every day?
Mm-hmm. So many things that you can start with asking yourself the question first, what is best for the patient? Mm-hmm. That's what I think of when you talk about that.
And and I think the best leaders in healthcare, the best leaders in any industry, look at it from the perspective of their customer, I guess. A lot of other industries, for us, we look at it the perspective of our patient. But in healthcare, it's different. At Prevea, it's even more different, because 50% of the owners in this organization, when they graduated medical school, they put up their hand and they took an oath. Same oath I took, the same oath that's hanging in my office. So responsibility is what's best for the patient. Are you living your oath? Are you delivering on the promise you made when you graduated medical school? And that means a lot to us at this organization.
This next value is really important, and that is to be inclusive. Talk a little bit about that.
You think about our mission to take care of people with passion, pride, and respect. We didn't define the people. It's everyone. It's everybody who walks through our door. For that to happen, we have to be inclusive from our doors to who we are as individuals working for Prevea. We have to figure out better ways in healthcare to demonstrate inclusivity. And we wanted to call that out in our values. Our people wanted to call that out in our values. And it really means a lot to us. Equity is a big issue in healthcare. Are we providing equitable care across the board? And for that to happen, the first step is, are we welcoming everybody into our doors? Nobody should ever come through our doors and not feel welcome, whether they're here for a job or here as a patient. And that's what inclusivity means to us.
Well said. Another value here at Prevea Health is to be well. What do you mean by that?
Well, I guess I started that question off fun, didn't I? Be well. If we're here for the health and wellness of our community, our people need to be well. Our corporate culture needs to be well. We need to be healthy. We need to be healthy to take care of people. Like I said, I've kind of gone through my own journey on this, and for us to be here for our patients, for us to be here for each other, we have to take care of ourselves. So at Prevea, we need to have focus on taking care of our own people and demonstrating how we do that to set an example for our communities on being well themselves. And that's physical health and that's mental health.
So important to distinguish that there is physical health and mental health as well. Absolutely. Let's talk a little bit about our next value, which is to be inspired. What does being inspired look like here at Prevea Health?
People a lot of times fear change. In healthcare, we need to embrace change. The needs of our community are going up exponentially every day, and the ability to meet those needs are tougher and tougher in healthcare. We need to be inspired. We need to find ways to change how we deliver care, how we approach care, whether it's in our exam rooms, in an employer's building, or virtually. We need to be inspired to change for the better, change ways that we provide care. If you look at our specialties across the board, the inspiration they provide in bringing new technology and technique to our communities every day, the inspiration they have is all based on the outcome. It's all based on what's best for the patient and to be inspired to change. So in a lot of companies, people fear change. You hear that this is the way we've always done it. And we really wanted to shake that up. Our people want to shake that up. They want to be inspired to do things differently, to win. And what does winning in healthcare look like? Our patients doing better. And that's really what our inspiration is. Once again, it comes down to what's best for the patient, and that's our inspiration.
Dr. I thank you so much for being here and explaining the 5 core values here at Prevea Health: to be kind, responsible, inclusive, well, and inspired. Any final thoughts?
I just want to remind everybody that, healthcare's a challenging profession too. And I think we saw a lot of challenges over the last 3 years with COVID, and that doesn't define us. We have gotten through the pandemic, but all too often we forget that we provide so much other care. And what we're here for isn't about when you're sick. What we're here for is all of you. So keeping you healthy, keeping you well, keeping you inspired to keep moving forward. That's what Prevea is about. We define that in our mission, we define that in our vision, and these values are how we make it happen.
Dr. Rai, thank you. And
thank you.
And thank you to our listeners. You've been listening to Plug into Health with Prevea Health. To learn more and to submit ideas for future shows, please visit prevea.com/podcast. And please remember, the information provided in this podcast does not constitute medical advice. It is not intended to replace interactions with your healthcare professional. And if you are concerned about your healthcare, you should consult with your healthcare professional. You can learn more about Prevea Health at prevea.com. Thank you for choosing to plug into health with Prevea Health.